Welcome, everyone. Today, we're breaking down a topic that is guaranteed to pop up on your nursing exam: nutrition. I know, it's a huge subject. So, our goal here is to give you a really clear framework to help you master it for the NCLEX. If you're feeling totally buried, trying to memorize dozens of diets and all these little nutritional facts, that is completely normal. But don't worry, in the next few minutes, we're going to cut through all that noise and give you a structured way to think about nutrition that's really going to build your confidence for test day. So here's the game plan. We're going to start with a quick review of the core nutrients, the building blocks. Then we'll dive deep into therapeutic and special diets, which are honestly at the center of so many NCLEX questions. And to finish up, we'll put it all into practice with a real clinical scenario, so you can see exactly how this knowledge applies at the bedside. All right, let's dive right into section 1, core nutrients. Before we can even think about getting into complex diets, we have to have a rock-solid foundation. We're going to do a quick review of the macronutrients, and you'll definitely want to lock in the energy values we talk about. Trust me, these are easy points on the exam you do not want to miss. First up, we've got carbohydrates. Now, the NCLEX loves to test on their main role as the body's #1 energy source. But here's the other key thing to remember. They're also crucial for sparing protein. See, if a patient isn't getting enough carbs, their body might start breaking down muscle for energy, and you do not want that, especially when someone's trying to heal. And here it is, your first magic number to memorize. NCLEX alert. Carbohydrates give you 4 calories per gram. Go ahead and commit that to memory. It's a foundational fact you just gotta know. Next up, proteins. Think of them like the body's essential construction crew, right? They are absolutely critical for tissue repair and wound healing. But they do more than that. They also help regulate fluid balance, maintain those acid-base levels, and even produce the antibodies we need to fight off infection.
And what do you know? Here's our next key number. Just like carbs, proteins also provide 4 calories per gram. Super easy. That's 2 down, 1 to go.
All right. Last but not least, let's talk about fats. Yeah, they're a super concentrated energy source, but they also cushion our organs, help regulate our body temperature, and this is a big one, they are vital for absorbing those fat-soluble vitamins. As you're about to see, they are by far the most energy-dense nutrient. And here is the big one to remember. Fats provide 9 calories per gram. That's more than double the energy you get from carbs and proteins. This distinction is huge. And believe me, that NCLEX loves to ask questions that test if you know the difference. Now this slide shows the critical difference between vitamins. Over on the left, you've got your fat-soluble ones, A, D, E, and K. See, the body hangs on to these, so they can actually build up to toxic levels if a patient gets too much. But on the right, you have the water-soluble vitamins, B and C, which just get flushed out in the urine. This storage difference is a massive patient safety point, and definitely prime material for NCLEX questions. Okay, moving on to section 2, therapeutic diets. This right here is the heart of nutrition on the NCLEX. Mastering these isn't just about memorizing lists of foods. It's about really understanding the why behind each diet to keep your patients safe. Okay, this is a huge nursing responsibility, managing a patient's diet progression, especially after surgery or when they've been on bowel rest. This step-by-step move from clear liquid to full liquid and then to mechanical soft is a fundamental safety protocol. You absolutely have to know which foods are allowed at each stage and the clinical reasoning for it. When you hear cardiac patient, I want you to immediately think DASH diet. And as you can see here, its principles line up really nicely with the MyPlate model. It's all about fruits, veggies, and whole grains while cutting way back on sodium and unhealthy fats. The whole point is to manage hypertension and lower the risk of heart disease. Okay, NCLEX alert. If you see a renal patient on the exam, bam! These 5 restrictions should pop in your head instantly. Protein, sodium, phosphorus, potassium, and fluids. Damaged kidneys just can't filter these things out effectively, so controlling intake is a critical safety intervention. This is pure high-yield info right here. And this table breaks it down for you with specific examples you've got to know. Being able to look at a patient's meal tray and spot a high potassium food like a banana or something high in sodium like cured meat, that's a super common application-style question on the exam. Fiber can be your patient's best friend or their worst enemy, and you need to know the difference. So a low-fiber diet, like you see on the left, is all about giving the bowel a chance to rest during flare-ups of things like IBD. On the other hand, a high-fiber diet does the exact opposite. It adds bulk to the stool, which is precisely what a patient with constipation needs. All right, on to section 3, special diets. Now, these are often based on a client's personal choices or maybe a specific condition that isn't covered by those standard therapeutic diets. As the nurse, your main job here is really education and making sure all their nutritional needs are being met safely. When it comes to your vegan clients, your biggest role is education. You have to be aware of these potential deficiencies, and the one you really got to know for the NCLEX is vitamin B12. Why? Because you pretty much only find it in animal products, so supplementation is almost always necessary.
Okay, time to put it all together. Let's get practical for our final section. The NCLEX isn't just going to ask you to list off foods. It's going to test your ability to use this information in a real clinical scenario to make safe patient care decisions. So let's walk through one.
Okay, picture this. It's a classic scenario. Your patient has a strict fluid restriction, but they are complaining of intense thirst. You can't just give them more water. That would risk fluid overload. So what's the move? This is all about your ability to provide comfort while sticking to a medical order. What are your priority interventions here? And here are your answers. This is what great, compassionate, patient-centered care looks like, right? These are all simple interventions that can relieve the patient's thirst without breaking that fluid restriction. And not only does this make them more comfortable, but it also makes them way more likely to stick with the care plan. This is exactly the kind of critical thinking the NCLEX is looking for. So at the end of the day, it all comes back to this. Beyond any single diet, your most fundamental role is to assess, to support, and to empower your patient. That means always checking their ability to eat and swallow safely, and doing everything you can to promote their independence and dignity during meals. All right, we have covered a ton of ground here, the essential framework for mastering nutrition for the NCLEX. So here's your homework. After this, go pick one therapeutic diet, maybe renal, maybe cardiac, and just do a deep dive. Master the restrictions, master the reasoning behind them, own it. You've totally got this. Thanks for watching.